Hello, I'm Dr. James McAdoo. Thank you for watching. I've been trained in plastic surgery, hand surgery, and general surgery, and dual board certified in 2008. Done thousands of surgeries and realized there's a better way to give you a facelift than by a scalpel. All the latest media shows that you can have local anesthetic and a scalpel surgery, but we have a better system now. There's a way to inject your original fat pads back to the volume when you're 20 or 30 with just a little cannula and some numbing cream on your face. Now, the product is made out of PMMA. It's 40 microns in diameter. What the heck is 40 microns? 40 microns is the size of a white blood cell. You can't feel or see it with your eye. And it goes in there and it sits next to the cells, and the cells form a capsule around that little bead. As it forms a capsule around the bead, it makes the tissue grow, so it stimulates your own body to make its own cells in the pocket of fat or the subcu or the skin that we put it in. It makes it expand 4 times the size of that bead. So now we have a way to calculate what you're going to look like, because the encapsulation takes about 6 to 8 months. So we mix that with bovine collagen, is another word for cow. Bovine collagen is used in the syringe to give you the immediate effect. So when I inject you, the day of the injection, you are going to look like that 6 to 8 months from now, when the beads take over the cow collagen, because that cow collagen reabsorbs. So now we have a way to predict how you're going to look immediately and into the future 6 to 8 months when you have conversion of all those beads being encapsulated. Once the conversion occurs, the bead never dissolves. So now we go beyond the time frame for every other product in the market in the world. This bead, since it does never dissolve, unless you're 200 degrees Fahrenheit, which people can't live there, or you have 80% alcohol in your blood, which people won't survive that. So barring those two conditions, this will never break down while you're alive. So now you have a permanent product causing permanent inflation of your fat pads, which makes a very semi-permanent appearance in the mirror. So now we have a way to make you look younger the longest beyond what any scalpel or other product can do. The product we inject does not interact with any other product you can receive in your face. Actually, we use this product in our technique to refine and correct asymmetry in areas where the fat cannot survive. So fat grafts, as we know, depend on the vascular supply of where we put the fat grafts. And usually if your skin is already thin in that area, it's unlikely that the fat grafts will survive compared to the next door area. Every time you revise, you have to recut and make more scar tissue, and actually encapsulates the nerves. You can have more complications from revision surgery. Plus, it's harder for the doctor to dissect that same plane from the rigid scar tissue that was built up from the first time they were in there. So we don't have to cut you to revise anything. We just inject with blunt cannulas. It allows you to have that youthful appearance without undergoing cut after cut after cut, and eventually having your cheek get pulled clear over to your ear. We can make your proportions like they were when you're 20 or 30 without the stretch trash bag effect. We experience all vast kinds of patients, including those on blood thinners and aspirin therapy for stroke prevention. We have ways to do this procedure that minimizes and almost completely eradicates the need for bleeding. And what we have realized is that we can place the product, the longest lasting filler, into certain parts of your face with a cannula that does not cut on the way in, so you don't have to worry about being bruised and having nerve damage and looking all swollen after you're finished. Now, if that does occur, we have techniques to get rid of that within 3 or 4 days, but the way it's put in is sort of like describing how we would icing a cake. We would put the product on top of the cake, and we don't just sit there and make a bubble. We use the cannula to kind of smooth it around like the knife on the cake and make it planed evenly with your own skin and bony tissue and subcutaneous tissue. So when you're finished, you have enhancement that blends and transitions to your entire face. We're not going to give you a block on the cheek. We're going to redefine the cheek, and everything that it attaches to is going to be transitioned together.
Never guess that I have anything done. They're just totally shocked when I tell them how much I have changed it and how much my chin, the profile of my chin has changed, and my lips know, and even we've tweaked my lips a few times, and are just so surprised and and then I'll have like, your eyes look a little different from my girlfriend. And they're like, what have you been doing? And I'll tell them. I have no shame in what I've got done. I love it. It just makes such a huge difference.
Well, I found out and heard about Dr. McAdoo and about the new product Artefill. Before that, I had tried some other products that I was not very happy with. Did not feel like I had a natural appearance. I felt my face looked more swollen and hard around the edges. Artefill, since I've started using it, I can tell a dramatic improvement, especially under my eyes, those bags. And I loved what the result I started receiving with the Artefill so much that I decided to continue and keep adding on. And I felt more confident in myself. A quick little in and out procedure that you're able to get in one day. I would recommend it for anybody. And I will continue using Artefill.
I love my Artefill. I recently had Artefill underneath my eyes. I brought up my top lip. I also was experiencing some sagging through the sides of my cheeks. And now I feel that I have a nice youthful lift. All my friends and family have said that I look about 10 years younger, so I'm totally thrilled with that and I can't wait to get more.